COVID cases in Oregon and Washington are on the rise again. And while you're not required to wear a mask in most places, health experts say it's a good idea now. I was able to talk to some of the leaders earlier today. So what are you seeing in Clark County? Is there an uptick in cases going on there?
Yes, and in the state as well.
Dr. Alan Melnick is the public health officer for Clark County. He told me the 7-day average of cases per 100,000 in the county is now 5 times higher than they were roughly a month ago. COVID patients are only using 9% of the county's hospital beds, but Melnick worries the number will go up. I think that people are not only tired of this pandemic, they're exhausted by it and so ready to move on that we're starting to have big in-person auctions and big in-person graduations and all that. And I wonder if it's just going to really, crank these numbers through the roof again.
But that's the one thing I left out in my little spiel to you earlier. So, I think you're right. I think it's going to be very difficult to go back to the mask requirements and all that. People are tired of it. And you notice what we're hearing nationally about people, even prominent elected officials, now becoming cases. People are going back to these activities, and we have a very highly transmissible virus.
Peter Graven is a science researcher for OHSU. He does the forecast for COVID in Oregon. How are things looking for COVID? It feels like we've got a surge going on.
You're right, we do. There's quite a bit of infection going on in Oregon with COVID. And, we knew that there was that infections were increasing in other places due largely to the BA2 variant, but also due to changes in masking policy. That was kind of the main policy that was still on the books. And, that restriction went away in March. And now we have seen increases in infections. The good news is that the hospitalization rate's been really low.
The Oregon Health Authority reports 171 patients hospitalized with COVID. That's far below the 1,100 at the pandemic peak. Graven thinks cases will continue to rise for another month.
My forecast that came out actually today is showing that, I see some more moderate increase over the next month or so, and then we should decline. That's given the kind of the variant composition that we know we have in Oregon. The viewers may know of BA4 and BA5, which are starting in South Africa and will probably spread to other places yet. We don't quite know the implication of that. It's another form of Omicron, and so therefore, likely to have that lower hospitalization rate, but could mean high infection rates again. And so, that's certainly something we're looking at. Right now, I'm not seeing a big surge on the hospitalization front from this. In fact, I'm seeing some good news in the Northeast. Some states there look like they've already probably peaked.